Peak flow meter is to test the maximum amount of exhalation after the maximum amount of inhalation. If we're trying to monitor their outflow of air, if we have patients who have had surgery, to make sure that the patient's lung function is good after their surgeries.
This can aid in the diagnosis of different conditions such as pneumonia, bronchitis, or COPD. And we're going to utilize a peak flow meter. And the meter is fitted with an individual mouthpiece for each patient, one-time use only. And what the patient's going to do is they're going to take a deep breath, deep as they can, and they're going to blow as hard and as long as they can into this. And each time the patient blows, there's a little red indicator that will rise as the patient exhales. And each time we're going to need to record that, and then we're going to reset this back down to 0.
It's kind of like a breathalyzer test. It measures your lung capacity. Our particular test gives an age on the lungs, and some of my students are a little disheartened when they see the age of their lung function. I've had students actually quit smoking because they've seen that, and they're like, oh my goodness, I'm 20 and my lungs are 35.
We're ready to do the test, and first thing we're going to need to do is explain to the patient what we're going to do. Okay. Here's what you're going to do for us. You're going to take a deep breath, as deep as you can, and you're going to blow into the end of this tube as long and as hard as you possibly can. Okay, any questions? No. All right, are you ready? Mm-hmm. Okay, you get to hold it, take a big deep breath, and then blow as hard as you can. Okay, now sometimes if we get a poor effort by the patient, what we can do is we can go ahead and start again. All right, take a deep breath for me, and blow it out. Okay, ready? All right, big deep breath. Blow as hard and as long as you can. All right, good job. We got a reading of 330, so that's 330 liters per minute, and we're going to record that in the patient's chart. Okay, we're going to do this 2 more times. All right, excellent. Okay, we got a 370 on that one. Reset it to 0. Okay, one more time, deep breath, blow as hard as you can. All right, excellent. And we got a 370 again, and we're going to record that in the patient's chart, reset our meter to 0, and that is it. That's the end of the test.
You have to be a big cheerleader. You can't just stand there and go, okay, blow, blow, blow. You know, you have to encourage the patient. So much of a part of what MAs do is patient care, but not only care, but it's all about how we are perceived. We are the face of the doctor's office, and I tell my students that all the time. So we have to be the cheerleaders. We have to be the patient advocate. You know, we have to be the one to go, come on, I know you can do this just a little bit more. That's all I need. We have to be the encouraging people.
Each individual result's going to vary depending on the size, shape, and condition of your patient, and also as well as age. And the physician is going to use the numbers from the test to determine a further course of treatment. Also, when we have a patient return and we repeat these, we would like to see that their numbers have increased. This will indicate that the patient is healing and doing well on therapy.